Morning, Mr. Reid. I'm here representing the National Center for Public Policy Research, a free market think tank, which is also a shareholder in Pfizer. My wife and I personally have owned Pfizer shares for some years. My question has to do with the future of healthcare reform. As you know, under different leadership, Pfizer, working with pharma, supported passage of the Affordable Care Act. Pfizer did so even though some of the provisions of the law will prove very costly to the company, and it did so despite the fact that greater government intervention into the healthcare system threatens to stifle innovation to the detriment of both the company and public health. Pfizer management apparently believed that the expanded market made possible through the individual mandate coupled with various concessions that it received from the administration prior to passage made the bill, on balance, in the company's interest. Now, however, it seems probable that the U.S. Supreme Court will strike down the individual mandate. On top of that, the administration has reneged on some of its concessions. So the law is at once less lucrative and more costly than expected. And to make matters worse, Medicare and Medicaid have critical fiscal shortfalls, and the government is looking to the company to help it meet its obligations. The good news is that the Supreme Court, or perhaps Congress, may give us the opportunity to do comprehensive health care reform all over again and in a much better way. The public is very much in support of a different approach. A Washington Post ABC poll, for example, this month found that the public opposes the Affordable Care Act approach 52 to 39%. So a strong free market reform package that protects innovation, shareholder interests, and public health stands a good chance of public support if we propose one and fight for it. So my question is, other than fighting against drug reimportation, de facto government price controls, and de facto rationing boards, such as the Affordable Care Act's Independent Payment Advisory Board, which the company has done all along and rightly so, what specific free market reforms of the healthcare system is Pfizer supporting, and which of these will it fight for?
Thank you for your comments. Well, you know, Pfizer fights for innovation, for access, and for a market-based system for pharmaceuticals. So within that, I would say, additional to the ones you mentioned, it would be no restriction on formularies imposed by non-elected bodies. Formularies should be set by the competitive marketplace, and we advocate that and work hard for that. It would be for the right to continue with direct-to-consumer advertising and, in fact, see a fundamental change in that, where there is a better balance between what we're trying to achieve with DTC and the long and difficult warnings we're forced to put in those ads. We would fight for a level playing field. Right now, the playing field is not level between the industry and the insurance companies vis-a-vis what we can and cannot say to physicians. Extremely tilted in the favor of insurance companies and payers' ability to instruct doctors to prescribe off-label. So we would fight for an equal level playing field on that legislation. We would fight for a pro-innovative FDA, one that is sheltered from undue pressure by different parts of society on risk-benefit. I think, in general, the FDA does a great job in getting the balance right between risk and benefit. That being said, I think one of the most complex endeavors that humankind undertakes is the development of a new pharmaceutical for humans. And as such, sometimes, for no fault of anybody, the risk-benefit isn't what we expect it to be when we launch. The FDA needs to be protected from that, because if they're not protected, it forces them to be very conservative and go far more towards safety rather than the balance of safety and efficacy. So we would fight for an FDA that has the ability to do that. And then lastly, probably for value-based insurance, where the marketplace decides the value of the medicines and the value of the outcomes and compensates pharmaceutical companies based on the value they deliver. So thank you for your question, and those are some of the things that Pfizer is fighting for.
One quick follow-on. As adults, we seldom get do-overs. It looks like we're going to have one. We need to aggressively use this opportunity, because if we don't, somebody else will, and the consequences may not be what we want. So please just be very aggressive in pushing free market reform. We'd appreciate it. Thank you.
Thank you for your comments.